It's great to see that case rates are down this week. I'm not declaring victory on any of that because it's only going to be over this weekend that we'll know the effect of the holiday weekend, including the big football games and all those kinds of activities.
Welcome to the RANE Insights on COVID-19 podcast. I'm Emily Donahue. Let's listen as RANE founder David Lawrence speaks with Drs. Fred Southwick and Bill Lang for our weekly coronavirus update.
Fred and Bill, once again, our thanks. A number of topics, obviously. We now have a presidential and governmental mandate around the vaccine. It'd be great to get an update on the data, the status of a third vaccine, and if we still have some time, I'll raise one other question that has been coming up from our audience. But why don't we start off on your thoughts about the government mandate?
Well, I'll go first because I know Bill and I have had a little difference on this. I am very pleased. I have felt for a very long time that the problem we have with convincing people is we know from population studies that about 25% of individuals will be are highly resistant to change and there's no rational way to convince them to take the vaccine. The problem is the pandemic is raging on because we have too many people unvaccinated, and therefore the only way to get this under control was to actually make it mandatory. And that's the right thing to do. The Delta variant is so much more infectious than any other variant that using masks and social distancing would help, but would not slow the spread to the point that the reproductive rate would get below 1. A combination of vaccination, masks, social distancing, I think has the potential to get the reproductive rate below 1. And once it's below 1, everything will finally quiet down. And I think the red light was the economy was flagging in this last month. So there was an impact of the Delta variant on actual business activity, as would be expected. So I think it's good from a standpoint of deaths and infections, and it's good from the standpoint of improving the business environment. Bill, your thoughts?
And Fred, I don't think you and I disagree at all on the importance of vaccination. My only disagreement was just kind of the personal liberty part of it, and where do you draw a line? And that's just it's the mandate of it. However, as you know, I work with a bunch of fairly large companies, and many of these companies also have the concern about requiring vaccination of their employees, kind of more of a corporate culture issue. And in some cases they feel more comfortable now that, hey, it's taken out of our hands. Even whether we do or do not believe that it's a good thing, it's not our issue. And from that standpoint, it makes it much easier. One of the big problems that we're already seeing with what we think the mandate is going to be, and I'll talk a little bit more about that in a minute, is this huge testing requirement that goes along if you are not vaccinated, because this still allows people outside of the federal government, it still allows companies to allow their employees not to get vaccinated if they get tested on a weekly basis. Well, companies have already had a shortage of access to testing for indicated testing. Now, if we have to start testing, as much as, at least initially, half the population, half the working population, we don't have the test capability in the United States to do that at that volume, and that's going to be a real problem. But let me go back now to just a moment about what actually happened. The answer is we don't know. We know the top line, that the president is directing the Occupational Safety and Health Administration under the Occupational Safety and Health Act to take an action to protect the safety of workers in a workplace. Now, that will be done as an emergency temporary standard. and the mechanism of doing even an emergency temporary standard typically takes at least a few days, a few business days, which ends up being a couple of weeks, to get the emergency temporary standard issued. And then it becomes the issue of what is the authority of the federal government to issue that emergency temporary standard on a nationwide basis, because the Occupational Safety and Health Act generally applies to individual workplaces. So it's going to be very, very difficult. There's going to be a lot of constitutional challenges to this. It's not clear at all which way it will end up going, because there obviously is a public health emergency, and it may be that it's reasonable within the Occupational Safety and Health Act, but a lot to be seen.
So, by the way, I know you guys are sort of students, great observers. I can't help but watch the opening of football season, conclusion of the baseball season, the U.S. Open, various golf tournaments, and observe that many people obviously are not wearing masks, and there are varying degrees around this country of enforcing of the vaccine mandate. And as you also know, there have been some criminal cases that have now been brought for people who are trafficking in fraudulent documents of vaccination. So, Fred, I'll go back to your point that you see the numbers on the economy, and obviously, you try to convince people to do the right thing on their own, but the government's mandate here, just seems like almost one final effort to get this done. And if you two were looking into the crystal ball, Fred, you're down in Florida, Bill, you're based in the Northeast, but you have clients elsewhere. Do you think this will make a difference? I think that's really the point here. Will this bring the numbers up in terms of the percentage of the population that's been vaccinated?
I do think that the mandate will make a difference. However, because of the high reproductive rate of the Delta variant, one person can infect 6 to 8 individuals. That means that the percent of the population that will need to be have achieved immunity will need to be in the order of 85 to 90%. So the mandate still will not cover everyone. It only covers those who have businesses over 100 individuals. So in addition to vaccination, it would be very important, if we can possibly do it, to encourage and actually, whenever possible, mandate the use of masks in public areas where there are crowds, and try to minimize those crowds. And David, you mentioned the football games, and I actually took a picture of individuals at the University of Florida football game, and I took a picture, I think, of about 50 people, and only one person was wearing a mask, and none of the coaches were wearing masks. Now this is in contradicts what we did earlier in the outbreak, when everybody wore a mask and we were keeping social distancing for any large events. I guess the difference is there's a significant percent that are vaccinated that are protected, which protects them for the most part from hospitalizations and dying. So I think that's why we're being more cavalier. But as we know, there are 30 to 40% of the people in that crowd were not vaccinated, and they were putting themselves in significant danger because the Delta variant does spread more readily in outdoor spaces when there's crowding as compared to the previous variants and the original virus.
So moving to the, and following on from that, because this is relevant, moving to kind of the data over the last week, the cases in the United States in general have been consistently down over the last week, roughly 10% week over week. In Florida, they're down by about a third week over week. And when you look at it on a state-by-state basis, there's only, I think it's 11 states today that have case rates that are going up. So that all sounds great. However, going back to what Fred was just talking about, last weekend, the big holiday weekend, first big weekend of football season, and it's really this is the week that kids are going back to school. So I'd say it's great to see that case rates are down this week. We're far enough from the weekend that the reporting issues should be all we were through that, because over the weekend many states just didn't report, so we should be picking all that data up. So all of that looks really good, but I'm not declaring victory on any of that, because we don't know what the effect. It's only going to be over this weekend that we'll know the effect of the holiday weekend, including the big football games and all those kinds of activities. Plus, it's the bulk of the United States is kids are just going back to school last week and this week. So if the schools are going to play a major role, we're not going to see that probably until over the course of the next week. So this time next week, if the data still looks as good as it does right now, I'm going to feel a lot better, but I'm not there yet.
Yeah, I completely agree. The next 2 weeks are going to be telling. Now, what's interesting in both Great Britain and particularly in India, the epidemic in those two countries suddenly dropped. And there was no real clear explanation for that. And one of the theories is that because the Delta variant is so contagious, all those who were ignoring social distancing, masks, and not getting vaccinated, who were out in public, had all become infected, if not clinically, subclinically, and therefore all those with higher risk behaviors actually were now immune from natural herd immunity. And that may be the explanation. We really don't know. I'm hoping that that's what's going on here. And if that's the case, then we might see the cases continue to drop. If that's not the case, then I expect a significant surge, and we'll begin to see it probably Monday or Tuesday of this coming week.
All right, so we'll stay tuned, and obviously we'll have more to report next week. And just as an editorial comment, which I know you guys share this view, so much of the response, so much of the communications with the public, so many of the, we'll call it the rules and regulations, really seem to be driven through a political lens and continue to be so. And, I'll note just, in California, you're having mandatory vaccination for students 12 and over. I think that's in Los Angeles. In New York, it's a different conclusion. And just sort of speaking for, the people in our network, businesses and community groups and not-for-profits, they just want consistency in terms of the advice. Just, provide sort of as clear as possible, recognizing that science continues to learn about this. But there really is an absence of consistent advice about what to do, both in terms of vaccinations and mandates, and but also, as you reopen schools, the quality of the environment, issues around air circulation and masking, et cetera. So in light of the data, the big question that is also looming is the potential of a vaccine for children under 12. Bill, you had commented on this before, but the FDA approval of Moderna's vaccine.
Sure. Well, I can hit each of them fairly quickly, and then Fred will have his thoughts on it. But the children's vaccine, I think 2 weeks ago, I said that it looks like, from reading the tea leaves, it's going to be pushed off until roughly first of the year. However, last week there was some talk that the administration was really pushing hard on the FDA to move the approval of children's vaccine, which meant the FDA pushing really hard on the manufacturers to get the data in. And manufacturers said that they think they can have the data by mid-October. So it may be that sometime in November that we'll have approval of the vaccine for children, at least the 6 to 12 group. Probably not the younger group, but 6 to 12. So that's one. Then in terms of the Moderna approval, that's been on track to be roughly a month behind the Pfizer approval. So I would think that we're probably going to see Moderna approval here over the next couple of weeks. I'd like to say certainly before the 1st of October, but I think that'll be pretty soon. I don't think it really makes a difference though, because there was already an approved vaccine, and for the average person out there who was saying that they're not going to get vaccinated because the vaccine's not approved, well, that excuse is off the table. The Pfizer is widely available, so I don't think the approval of Moderna makes any difference in the vaccination rates that we're seeing. And then on to the booster or not to boost. I don't mean to sound like a lawyer. I never want to sound like a lawyer, but it depends. The Pfizer data is pretty good. And this is where Fred can really comment on this. The Pfizer data is pretty good that a booster is going to be needed, and that's because the Pfizer was a lower dose of the original payload of the mRNA, plus it was given closer together, and both of those things decrease the long-term antibody response. The Moderna has been saying all along, up until it seems like they got their arm twisted a couple of weeks ago, that they've been saying, we don't see it. We don't see the need for us. Then they started saying yes. Big study came out yesterday that said, again, the antibody levels and the epidemiologic data with Moderna is saying it's not a clear need for an additional vaccination. Plus, Moderna is testing. They're not asking to give a third same dose vaccination. They say if they do it, it'll be a half dose, but because they're changing the dose, it's going to take a significant amendment to the emergency use authorization. And so that may delay even further the use of a Moderna booster. So the sum of all that, I think that we're going to have a Pfizer booster approved towards the end of this month. I don't know if it'll make the September 20th date that the White House originally put out. I think that a half-dose booster for Moderna is possible, but that probably won't come until next month, if it does come. And J&J, it's just, I'm not clear at all on where we stand with J&J.
Bill, that was an excellent summary. That accurately reflects the data. And what they're doing, though, predominantly, the conclusions by Pfizer are the result of neutralizing antibody studies, where you mix serum from people that have been vaccinated at different dilutions and see at what level it kills the virus. When it gets down to under 1 to 30, they worry that your protection is reduced. That's what we call a surrogate marker. It may, I think it overestimates the deterioration of the vaccine and does not take into account cell-mediated immunity and the ability of actually B cells to, when they get exposed to the virus, to rev up the concentration of antibody very, very quickly. So there is a tremendous debate, because should this vaccine be going to us in boosters, or should those doses be going to other countries that are not yet vaccinated? If you really want to be the most effective at controlling the pandemic, rather than giving boosters to most individuals, it would make sense to transport that vaccine to other countries that have insufficient vaccine. So I think that's where we are. And it is true, Moderna, when you look at the initial levels of neutralizing antibody and total antibody, they are about 2 to 3-fold higher with Moderna than they are with Pfizer, explaining why the levels are staying up for longer with the Moderna vaccine.
And this most recent study I saw just this week was that epidemiologically, it's bearing out. We're actually seeing less breakthrough infections with Moderna than with Pfizer. So the one thing I would say, Fred, about the international piece of it is I agree completely. There's this whole ethical issue. Should resource replete nations be taking up vaccine that could be used by emerging markets? The one thing that on that is that the mRNA vaccines do not lend themselves very well at all to the emerging markets because of the cold chain and logistics requirements in giving them. But that doesn't apply to J&J. That doesn't apply to AstraZeneca. That probably will not apply to Novavax, which has been very quiet on what's happening with that next front. So from that standpoint, I don't feel quite as bad about the idea of a booster, but clearly we need to get the rest of the world covered.
Yeah, Bill, that is a very important point.
All right, so just in a couple minutes that we have remaining, would like to ask a rhetorical question, which is, does the data continue to demonstrate that the overwhelming number of people who now require hospitalizations are individuals who have not been vaccinated? I saw a number as high as 99% of the admissions. And is the data still bearing that out?
I can tell you at UF Health, it definitely is. We actually have graphs of each week, and it's 95% of those that are hospitalized are unvaccinated, and about anywhere from 2 to 5% are vaccinated. And those that are vaccinated, it's almost always individuals over the age of 65 or those that are immunocompromised. Either they have cancer or active cancer, or they're a transplant patient who is receiving strong immunosuppressives.
There's also some degree of concern about the Mu variant, which experts are tracking now and trying to understand. What can you share with us about what you know and what we should be looking for?
Yeah, the Mu variant originated in Colombia, and it is spreading throughout the United States. It represents a very low percentage at this point, but it has, most of the variants have between 9 and 12 amino acid mutations, or changes in amino acids, and this one has 9. And it has a lot of the mutations that the other variants have had, like the E484K, and it also has a mutation at the furin cleavage site, which we talked about with the Delta mutant. Turns out to be very, very important, and that's it's a P681H, and in the Delta variant, it's a mutation at that same site, and they were actually, it's a very nice study for the Delta variant, showing that the mutation, the Delta, actually causes, when the virus is replicated in the cells, it's actually the spike protein is cleaved by furin before it's released. So the virus is activated at the point of release from cells, so it can get into cells 3 to 5 times faster. Now, I have not seen a reproductive rate for the Mu variant yet. So we don't know whether or not it's as infectious as the Delta variant. I doubt if it is. But we do know that the E484K does render vaccines a little less effective. And there's one study in Rome which has actually tested sera with the Pfizer vaccine and shown that neutralizing antibody titers are a little bit lower, but still the vaccine still is protective. So if this Mu variant does not have as high reproductive rate as the Delta variant, it's highly unlikely it will take over, looking at the mutations that are present in this virus.
So one article I read this last week was an opinion, it was from a virologist opinion article, and it was talking about Mu will be sporadic because it does have all these mutations that do increase its effectiveness and resistance. But Delta is so much more effective at creating infection that it will keep mu from becoming a major player. But then the article went on to say, and Fred, I'd be very interested in your thoughts on this, is that the Delta variant, that any new significant mutations will likely come off of the mu variant. And therefore, as we start thinking about additional vaccination, getting a modified vaccination that is more tailored towards Delta is going to be very, very important, not only for stopping the epidemic where it is now, but for protecting us in the future.
Yeah, I agree. With the Delta spreading in such a huge population, the probability of a further gain of function mutation is very high. Remember, the ability to replicate the RNA, there are errors made by the virus, so mutations are expected. The more people that are the more likely there will be a mutation that improves its ability to spread in the population. So what I would predict is the Delta variant that is more resistant to the vaccine is possible, as long as we have so many people unvaccinated who are then infecting those that are vaccinated. And then these escape variants will come from infected, vaccinated individuals.
Fred, Bill, again, thanks for really keeping us informed and situationally aware here. Look forward to speaking next week. This has been very, very helpful. And in the interim, just stay safe and well.
Thank you, David.
Thanks, David.
Dr. Bill Lang is an expert in public health responses to biological incidents, including pandemics. Dr. Fred Southwick is an infectious disease specialist at the University of Florida College of Medicine. Both doctors are part of the RANE Expert Network. Individuals and organizations turn to RANE for risk intelligence that cuts through the hype to focus on what they need to know, what to expect, and what to do. Sign up for our coronavirus solution and get critical information on the COVID-19 pandemic delivered daily. Visit us at ranenetwork.com. That's RANE network.com. I'm Emily Donahue. Thanks for listening.